Hi everybody, Professor H here. We are continuing with our lectures for developmental psychology. Tonight's lecture is the first part of Chapter 3, Birth and its Cultural Context. I'm going to do something a little bit different tonight. I'm going to go ahead and get us on our screen share here. I'm going to click off of my video button because it makes me really nervous to see my face up there when I'm trying to talk. It's just somewhat unsettling and unnerving. All right, I'm going to go ahead and start our presentation. Birth and its cultural context. In this video, we're going to talk about the birth process and historical and cultural variations with the birth process. The birth process has 3 stages. The first is labor, the second is delivery, and the third is the expulsion of the umbilical and placenta. Basically, when you're going through this process and you are pregnant, at a certain point, your body, your pituitary gland, starts to release oxytocin, which starts the labor to begin. All right, so let's start taking a look at these. Stage 1 is labor. It is the longest and most taxing stage. The pituitary releases oxytocin starting contractions. The contractions in the uterus cause the cervix to dilate. That means it causes it to expand. Labor is painful, but there are some ways to ease the discomfort, and different cultures have different ways that they approach this. The contractions that you experience in labor are muscle contractions, so they are very, very painful for the same reason like a muscle cramp would be painful. At the peak, you would have 60 to 90-second duration cramps. There's a lot of back pain, nausea, trembling. Some people vomit during the labor process. And the goal of the labor process is to get the cervix to dilate or open up to 10 centimeters, which is approximately 4.5 inches. In developed countries, the husband or other family members often assist with strategies to ease the birth process. In many cultures, men are not allowed anywhere near the birthing area or near a woman who is giving birth. In developed countries, we also have certain things that we try to do in order to help people feel more comfortable when going through labor. A woman oftentimes will listen to music, will get up and walk around, will try relaxation techniques. There are different things that people try to help ease the pain of the labor process. And there are ways to, focus your attention in a different way. And these are all things that in developed countries people do during that labor process. The second stage of the birthing process is delivery. The first birth that a woman has usually takes about a half an hour to an hour to deliver the baby. So you would start off in labor. That labor process can be anywhere, on an average of about 12 hours for the first birth. Labor usually lasts less time for the successive births, about 6 hours or about half the amount of time for the second birth. When that stage is completed and you move into the birth process, the actual birthing process only takes about 30 minutes to an hour if all is going well. After the cervix becomes dilated, the woman starts feeling an incredible urge to push. What happens at that point is the woman is directed to push, and she has to push the fetus through that cervix, which is that 4.5-inch opening, and to push him out through the cervix, out of the uterus. And then what happens at that point is called crowning. Crowning is when you see the baby's head start to appear out of the vagina. When crowning occurs, the woman usually feels a tingling or burning in the vagina. And oftentimes people receive what's called an episiotomy. Now, this is an incision that helps to open up the vagina for easier passage of the baby. There was a period of time, like in 1970, where 70% of women had an episiotomy. These days, it is considered to be an unnecessary thing. By 2012, only 15% of women had an episiotomy. Only about 8% of African American women get episiotomies, and currently 15 to 16% of other women get episiotomy. So the last stage of the birthing process is that the baby emerges from the vagina. So boop, out comes the baby. Once the baby is out, you are not done with the whole process. There is more that has to be expelled from the body besides the fetus. This illustration shows the process. So here in this first image, we see that the cervix, which is this little area here that I'm circling, is very narrow. And the contractions that the woman has will expand this diameter right here. So the cervix will open up, and you see here we have the cervix is open and the transition is occurring. Now the baby is ready for the second stage, which is the birth process, where the baby will be pushed out of the female's body. First, we have the head, which crowns. First, we have the head that crowns. You just see this part. And then next is the shoulder. And then the rest of the baby just comes out real easily after the shoulders. The third stage is called expulsion of the placenta and umbilical cord. So remember that the placenta and the umbilical cord were very important structures for the developing fetus. However, they are no longer needed, so the woman's body needs to get rid of these. And the way that that is done is through contractions. So just like when the woman was giving birth, her body will continue to experience contractions until the placenta and the umbilical are expelled from the body. If the umbilical cord and the placenta are not expelled from the body, a woman can continue to bleed. It can actually cause her to fatally hemorrhage. So if the woman is not expelling that placenta and umbilical cord, then at that point they give some medications in order to help her have more contractions. They give oxytocin in order for her to have more contractions to help her expel that. The other thing that helps is if the woman decides to breastfeed, when the baby starts to breastfeed, her body will naturally release oxytocin, which will cause her to have contractions, helping her uterus to expel the placenta and umbilical cord and helping her uterus to contract. So throughout the early times after birth, as she is breastfeeding, her uterus is starting to contract back to its pre-pregnancy size. Birth complications and cesarean delivery. As I mentioned, if the birth process, there's a couple of problems that people have. Failure to progress is one of them, and that is when the birth process is taking longer than normal. And failure to progress is like, once I mentioned that we had a half an hour to an hour, we should be having that baby born during that period of time. When it's taking longer, then we start to worry if that baby is going to be safe, if that mom is going to be safe. And sometimes a tool such as a forceps may be used, and other means can be used. If the failure to progress continues, it could end up in like a cesarean delivery. Breech presentation is when the baby, instead of being head first to come out that birth canal, they are either buttocks first or feet first. About 4% of fetuses present in the breech position. That can cause the umbilical cord to be constricted, and if the umbilical cord is constricted, it only takes a couple of minutes for brain damage to occur in that fetus. So it's really important to try to be safe. If you know you have a breech birth, most of the time that will end up in a cesarean delivery, which is that surgical delivery. We're going to talk about that in just a minute. Cesarean delivery, we call that a C-section. That's retrieving the baby directly from the uterus. That is where they basically just cut you open and take that baby out. High rates of C-section may be due to extreme caution, and a vaginal birth after a C-section is possible. They used to think that you couldn't have a vaginal birth after a C-section, but we know now that a person can have a safe vaginal birth after a C-section. Interestingly, your book mentions that the C-section was named after Julius Caesar, where 2,000 years ago it is said that he was born via C-section. Most moms died from an attempted C-section up until recent times. All right, and there are other reasons for C-sections besides what we have up here, besides the cesarean, besides the failure to progress or the breech presentation. Sometimes if somebody has a sexually transmitted disease, they may also want to have a C-section to minimize the exposure to the baby, to the mom's bodily fluids on the way out there. The rates of C-section vary from country to country. Here's a graph of the rates and percentages of births by cesarean section. If you'll notice, more than 30% of babies are delivered via C-section in the United States and in several other countries around the world. Now, according to the World Health Organization, in order to reduce neonatal mortality and maternal mortality, that's neonatal meaning the baby dying, maternal mortality meaning the mom dying, in order to reduce that, the ideal rate worldwide is about 10 to 15%, and there's some other research that says that maybe as high as 19%. So as you can see from this image, more than 30% is the percentage that the United States, we have here Mexico, we have Australia, and several other countries are having very high rates of cesarean sections, much higher than is recommended. There are some different reasons for this. I'm not sure exactly what the reasons are, but what I can tell you is that here in Northern Europe, and let me see if I have the other graph in here, no. Okay, up here in Northern Europe, here we have 15 to 30% in a lot of these other countries. 15 to 30, that's at least, within, this 15, the lower end of this is within that ideal amount of cesarean sections being used. And Europe has very low rates of cesarean sections. In Northern Europe, they have low birth complications, and their beliefs are that birth should be as natural as possible, and they have low rates of complication, very low rates of C-section. Africa and India, some of these other countries, they have low rates, but that's because they have low access to medical care. And so if you can't go to a hospital and you can't get that medical intervention, then you obviously can't get a C-section. A lot of these developing countries, people have their children in their own home, and they do not have access to a hospital. Okay, problems that are unique to the human species when it comes to birthing. Consider that a 500-pound polar bear delivers a baby whose head is much smaller than a human's. A gorilla, the baby is 2% of the mom's weight, and for a human, the human baby is 6% of the mom's weight. Over evolution, human brains have grown 3 times larger. So as humans have developed through time, their brains have gotten bigger, which means their skulls have gotten larger, so their heads are bigger. However, the female pelvis did not expand at the same rate that our brains did. Therefore, these big-headed large-brained, not brined, large-brained fetuses are very hard to deliver. So we are kind of unique as a species to having as much difficulty giving birth. Yeah, we have the hardest time of any species. There are a lot of different cultural beliefs around giving birth. Some are helpful, some are harmful. Some of the most harmful developed in the Western cultures, here in the United States, actually. Early medical interventions in the 19th and 20th century actually caused a lot of difficulties, and it has only been over the past 50 years that medicine has helped mothers with birth. Prior to that, medical intervention was actually harmful to a female giving birth. Let's take a look at that. So before the medical industry became interested in birthing, midwives used to take care of that type of duty. So before the 15th century, most births were carried out by midwives, and midwives were very respected in the community. However, what happened in the mid-15th century, or right in the 15th century, the Catholic Church decided that midwives were quite possibly witches. A couple of monks actually developed a manual in 1448, a witch hunting manual that was put out by some Catholic monks. And in their manual, they quoted, here's a quote from the manual, "No one does more harm to the Catholic faith than midwives." And so a lot of midwives were being suspected of being witches, so they were like burnt at the stake and put to death and that kind of thing. The Catholic Church then decided that they would go ahead and give licenses to people to become midwives so that they could keep out the witches. So after that time, a lot of midwives were killed. People who were being midwives were having to hide out, lay low, kind of sneak around to try to help people deliver their babies. And then in the 18th century, medical schools were taking off, and in those schools, it was decided that physicians should deliver babies, and the field of obstetrics was established. However, the medical training was very inadequate at that time. And during that time, there were some very kind of backwards beliefs about what a doctor could and couldn't do. For example, it was improper for a doctor to see a woman's genitals. To learn about birth, they would have to get that information from lecturing or books. They weren't allowed to take a look under the hood and see what was going on under there. Also, they were trained in using forceps, and forceps, I'll show you an image in just a minute of what forceps look like, caused all kinds of brain damage to babies, all kinds of tearing and damage to mom, and about half of all American births towards the end of the 19th century were delivered using forceps. And the forceps can be safe and can assist in a delivery, but only in the hands of a very skilled physician. So I'm going to jump ahead here. This is what forceps look like. 19th century illustration of the use of forceps. I don't know if they still look like that, but that gives you the idea anyway about what it was. So one of the biggest problems with medicine being involved was that back in the late 1800s and the early 1900s, there was a lack of knowledge about infections and how things spread. So what happened was doctors would get in there and they would be doing an autopsy, and then all of a sudden they're going to go deliver a baby, and they just wiped their hands off. They didn't wash their hands. So they would like do an autopsy, run over there, deliver a woman's baby, wipe off their hands, go to the next baby, wipe off their hands, go to the next one. And then all of a sudden, here we have a huge rash of what that was called childbed fever. And a large percentage of women were dying. In the 19th century, 1 in 20 women died Sometimes the rates were higher if there was an epidemic of childbed fever. In Boston Hospital in 1883, 70% of women who delivered in a hospital got childbed fever. 20% of them died. It was the 1940s before hand washing became a standard practice and before antibiotics were being used. So this video, I'm going to go ahead and show you guys now. I'm going to exit out of our, let's see, open our link, see if we can do that. Okay, I've got to empty out of the exit full screen. All right. In Western cultures, this is just kind of a recap real quick. The 20th century, doctors were not properly trained. However, as time went on, we learned that hand washing was important. So people started washing their hands, using antibiotics, that sort of thing. And then that led us to our next interesting use of medicine when it comes to childbirth. And that would be using medications like morphine. The goal in this using drugs like morphine was to help control a woman's pain so that they would not have to experience so much pain during childbirth. However, the big problem with that is that it caused other issues like bleeding, seizures, just all kinds of different things that would occur by using a drug like morphine. It was just a little bit too much overkill for that. All right. In the late 60s, there was a backlash against the medical type of childbirth. After the use of morphine was discontinued, they started using some other medications, and this led to something called a twilight sleep. So they would give you the heavy dose, and then they would go ahead and then you would deliver your baby, but you wouldn't really remember anything. Sometimes you would basically be strapped down. Oh, and it was morphine. So the morphine would increase the dilation. It would help you not feel pain, but you also wouldn't remember the process. Oftentimes a person would scream, flail around. They'd end up putting a helmet on, tying a person's hands and legs down, and they would not remember the birth as a painful process, but they wouldn't remember the birth at all. And then once again, there was these other issues with using that morphine. In the 60s, basically there was a backlash against this, and people started leaning towards more of a natural type of childbirth. The critics of the medical model of using the morphine were saying that, oh, they're just doing that to make money, and the advocates were saying that natural childbirth is better for the child, better for the mom, and that it's an experience that should be remembered and shared. Natural childbirth normally includes taking some sort of classes in order to learn how to control the pain, how to manage and work through the contractions. And basically, when people do a natural childbirth, it was always a good idea to do this in a way to where you could access emergency medical care if you needed it. With hospital deliveries, there was not a big difference between hospitals and having the child at home, between maternal health and neonatal outcomes, between natural and medical methods, as long as there is access to emergency care if something were to go wrong. Medicated birth, this is just a image that shows the twilight sleep. This is an image from 1946 that shows a new mother under sedation giving birth at a London hospital. This is where they're put under with the morphine, and they called it twilight sleep. Today in Western cultures, one of the most commonly used medical interventions is an epidural. An epidural is a injection that is given in your spine there to limit the pain that you're going to feel during the birthing process. let's see what facts I have on this. Okay, so it basically, they put that in your cerebrospinal fluid, kind of low. You will still feel the urge to push. You will remain alert, and you may need to have oxytocin though. Sometimes getting an epidural may reduce the response for the pushing, and you may need to have more oxytocin to help the contractions to continue, because that medication might dampen some of the contractions a little bit. 76% of women in the US have an epidural, 52% of women in Sweden have it, 45% in Canada, and only 24% in New Zealand. So those are just some cultural differences between, you know, for using an epidural. Electronic fetal monitoring is a way to track the fetal heartbeat. Sometimes they monitor by putting the sensor on the mother's abdomen, and sometimes they can go in through the cervix and put it on the baby's actual scalp. So those are different ways that that can be used. Oftentimes, if they're concerned about how the baby is, how the things are going, if the birth is taking a long time or anything is going a little bit weird, they want to monitor that heart rate, make sure that that fetus is able to maintain their heart rate. And if something goes wrong, you may have to take emergency procedures like a C-section. Okay. Birth across cultures, who helps? In traditional cultures, I mentioned earlier that in a lot of traditional cultures, men are not allowed to be around where women give birth for a lot of different reasons. We kind of mentioned earlier in one of our other lectures that sometimes it is considered that a woman is unclean during that time and should not be around men or others. Historically, older women are the main assistants within traditional cultures, and women often have a midwife or an older lady that is experienced that helps them through this process. Births tend to occur at home among the less wealthy people. And today, some births take place in medical settings with trained personnel. However, a lot of people in these traditional cultures do not have access to hospitals. In developed countries, midwifery is having a revival, now about 10% in the US. So 10% of US births involve the use of a midwife. We have birthing centers that are separate from a hospital. Midwives are more common in Europe than in the US. In Europe, it is a majority of people that use a midwife for their deliveries. Socioeconomic status makes a difference, oftentimes, of whether or not somebody has the opportunity to use a midwife these days. And a little comment here I have on my notes is that in Norway, almost all births involve midwives. Here's an image of a traditional culture. It says midwives are usually the main birth assistants in rural areas of developing countries. Here, a midwife attends to a pregnant woman in her Cambodian village home. So this is a setting that somebody may have in their home. This is kind of a traditional type of environment right here. Birth across cultures. Practices aimed at diminishing danger and pain. In traditional, well, most cultures celebrate birth. Some have fear or wariness about birth, and that there are purifying traditions for mothers after birth. Back in early times in the Catholic Church, I know there was a type of cleansing type of ceremony that the mom would go to before she goes back into the church, or she would come up to the front of the church and the priest would bless her before coming in. Trying to see the name of the ritual. It just says cleansing ritual. Oh, churching. It's called a churching ceremony. And that was, you know, due to a belief in the past that the blood and fluids that a woman has during birth are just unclean, and she has to be cleansed before joining back to the church again. Let's see. In some other cultures, women are only allowed to be in certain areas to go have birth that are considered contaminated type activities can go on there. So it is also in some cultures just believed to be an unclean activity. The placenta has meanings. In some cultures, they bury the placenta in a sacred place. Some cultures believe it has value for hormones and nutrients. Burying it in a sacred place, oftentimes there are cultures that feel that this placenta is like some sort of twin that has been born at the same time, and if you don't dispose of it properly, you'll have a negative outcome. For example, the baby will have pimples, or the baby could die. Some places have where you have to burn it, or you have to throw it in a river, or you have to deposit it in a special place. In the Malaysia, Ghana, and Indonesia, it is considered to be a sibling and is semi-human, so you have to treat it with reverence and respect. Often the beliefs come down due to a lack of control, and by having these types of beliefs, you feel like you have more control over your environment. Traditional cultures have many practices that are aimed at making the mom more comfortable and helping keep her and the baby safe throughout this process. Easing the birth process, one thing is abdominal massages and herbal teas. Interestingly, Western medicine has now picked up on these abdominal massages, and that is a thing that we do in the West now today. Herbal medicines to cope with pain. Midwives give instructions and encouragement because they're experienced and have been through it before. Symbolic symbols placed in different areas. So there are different ways that within a particular culture, there might be some type of symbol that has some type of spiritual meaning or some type of power to help with the birth. On your screen, the book talks about placebo effect, and that is just saying that whether or not these things, that it does in the book, it talks about the lady's having a difficult birth, the baby's not making good progress, so they prayed to a particular god that has to do with the uterus, or a spirit that has to do with the uterus, and then there's a battle between good and evil in the uterus until the baby finally comes out. And the placebo effect would be referring to the emotional type effect that would have on the mom, and maybe it would be soothing and comforting to have that take place. And by her not being so stressed and upset, it might help move the birthing along and help with the situation in a placebo type of manner. In developed countries, what we usually do for our moms that are in labor is changing the birth position frequently. In other words, moving to different places, listening to music, breathe in a steady rhythm, fast or slow, take a shower or a bath, have a massage between contractions, just focusing your mind somewhere else, and having emotional and social support, having your partner with you there, or somebody that you care about and that cares about you there to help you through this process. Those are things that also seem to really help. All right. The last thing we're going to take a look at is neonatal and maternal mortality. Neonatal and maternal mortality rates are vastly higher in developing countries than in developed countries. However, maternal mortality decreased substantially over the last 30 years in developing countries. So in other words, they had higher rates of neonatal and maternal mortality, and the rates of maternal, the moms dying, has been getting lower over the past 30 years. The neonatal period is still the most vulnerable time for a child's survival. And the interesting thing here for me is that there's a higher neonatal mortality rate in the US than many of the other developed countries, and twice as high for African Americans as whites. So when it comes to the developed countries, we're not doing so great in the areas of neonatal mortality or maternal mortality. So we're going to take a look. I think I have both graphs. Yeah. So this first one is looking at neonatal mortality. So neonatal mortality, we're looking at deaths between the first and 28 days of life. That's when the new baby is most vulnerable. And what we're going to see here is that these this is for neonatal, this is for the babies dying. For neonatal mortality worldwide, we can see that the United States, Canada, Europe over here, Australia, looks like Chile, and some other little countries in here, have very low rates of neonatal mortality worldwide. So 1 to 5 per 1,000 live births for the neonatal mortality. And then we can see that it's 6 to 15 in a lot of the places in the world. And then over here in Africa, we see the worst, 31 to 45 out of 1,000 live births that are dying during that first 28 days of life. Okay. All right, now maternal mortality, we're not doing quite as well. If you take a look here, we're looking at the deaths of mothers per 100,000 live births. And in Europe, you'll see that over here in Europe and Australia, and these guys are using kind of different birthing methods than we are, a little bit of more traditional, natural types of methods. They have less than 10 in 100,000 deaths. The United States, Canada, not doing quite as well, 10 to 99 out of 100,000 for maternal mortality. And there are some other statistics in here that you can't see, but your book does show these statistics, that the neonatal mortality is 2 times more in the US than the Czech Republic, Finland, Japan, or Portugal. Within the US, African American mortality for the African American babies is 2 times higher due to lower socioeconomic status and lower access to health care. So when you look at white versus African American neonatal mortality, we see 2 times more for the African American. Okay, maternal mortality has been increasing since 1980 in the US. So we don't know really why. We just know that maternal mortality is increasing steadily since 1980. All right, I think that's it for us. Yeah. All right, guys, I'm sorry this has been kind of a bumpy ride. I hope you guys can get through this video okay, and I'm going to put my video back on. There we go. All right, so this one's a bumpy one, pretty rough ride. Hopefully it will be very useful for you, and hopefully it can clarify a few things. And I'll see you next time. Have a really good evening.